Okay, good morning, everyone. My name is Liz Charles, and today I'll be your instructor. Could you introduce yourself to me, please?
Okay, I am student nurse special assistant.
I am student nurse Akila Richards.
I am student nurse Deja Marie Mitchell.
Okay, is this your first time working on the ward, or have you been here?
We've been here before for 3 weeks.
Okay, and would you say that you're acquainted with the patients on the ward?
Yeah. Mm-hmm.
What could you tell me about the patients on bed one?
Patient on bed one, her name is Jenny Williams. She is 67 years of age. Her last vitals were a BP of 148/69. Her pulse was 88, SpO2 98%. Respiration, which was 32, which is higher than average. We also did an RBS on her, and her sugar came back as 454. Her temperature was 37.1. She was admitted onto the ward on the 2nd of December 2021. She came in disoriented or confused. She had fruity breath and she had elevated levels of ketones when we did a urinalysis on her. Her medical diagnosis is diabetic ketoacidosis.
Okay, what could you tell me about diabetic ketoacidosis?
Diabetic ketoacidosis is a serious problem that can happen in people with diabetes if if their body starts to run out of insulin. It occurs when the body starts to break down fat at a rate that is much too fast for the body to handle. When this happens, harmful substances called ketones build up in the body, which can be life-threatening, and if it's not found and treated quickly. Insulin deficiency increases insulin counter-regulatory hormones and peripheral insulin resistance, lead to hyperglycemia, dehydration, ketosis, and electrolyte imbalance. Due to the lack of insulin, tissues such as muscle, fat, and the liver are unable to take up glucose. Even though the blood has an extremely elevated amount of circulating glucose, the cells are basically starving. Because the blood does not require insulin for glucose to diffuse across, the brain cells are receiving more than an adequate amount of glucose. Basically, the general body tissue is starving while the brain has more than an adequate supply of glucose. Symptoms associated with hypoglycemia. Due to the lack of insulin, the body is not receiving an adequate fuel source to produce energy. Even though the blood is loaded with glucose, the cells go into a starvation mode. This triggers the release of glucagon and other counter-regulatory hormones that promote the breakdown of triglycerides into the fatty acids and initiate gluconeogenesis to produce more glucose for the starving cells. This further elevates the blood glucose level as the body begins to metabolize protein and fat to produce a source of energy. Due to the insulin deficiency and release of large amounts of glucagon, free fatty acids circulate in abundance in the blood and are metabolized acetoacidic acid and dehydrobutyric acid and refers to ketones.
Okay, you all are accustomed. You all are accustomed to listening theories. So could you all give me a theory that you think would be well suited for this case and give me a brief history on the theorist as
Okay, so the theory that is best suited for this case would be the Roy's adaptation model. The Roy's adaptation model was developed by Sister Callista Roy in 1976. She was born on October the 14th, 1959, in Los Angeles, California. Sister Roy was named after the Roman Catholic saint Callistus. She grew up in a household that was strong believers of Catholic. She began working at a local hospital at the age of 14 years in the food department, and she studied and worked hard and continuously until she gained several masters and doctorates from different institutions. So, a description of the theory: Roy's adaptation model focuses on the initiating a coping mechanism for individuals to function in a changing environment. It asks the question, who is the focus of nursing care? What is the target of nursing care? And when is nursing care indicated? This theory is still used today in the clinical settings to help patients achieve better health. The concept that this theory utilizes: adaptation, the process and results which the individual utilize to make themselves aware and ensure they choose to become integrated with others and the environment. Person, with the individual or the human being who choose to adapt to their changing environment. Environment is the circumstances that influence the impact of the development and performance of a person as the adaptive system, also referred to as the stimuli, health, the state of being and becoming unified and whole, which would, as a result, increase their adaptation level. Nursing, the promotion of healing, adaptation, and health combine together to benefit the individual. So the paradigm and the assumption: the paradigm looks at the framework containing the basic assumption, the ways of thinking and methodology that are commonly accepted by members of the scientific community. With the Roy's adaptation model, that would be the way patient care is achieved. The assumption is that the individual is a biopsychosocial being who is continuously interacting with a frequently changing environment.
Okay, so part of nursing care is creating a care plan for the patient themselves, right? So I'd like you all to create a care plan for this patient, given 2 nursing diagnoses and 1 response.
Okay. So when we're doing a nursing care plan, we have 5 stages of the nursing process which we need to achieve. So we have the assessment, the diagnosis, the plan, the intervention, as well as the evaluation. So when we assess the patient, we realize that she has signs of confusion, which was mentioned previously. Therefore, her diagnosis will be impaired memory related to the fluid and electrolyte imbalance. So the plan would be vital signs will be within the normal range, balanced fluid input and output charting, and normal electrolyte levels. So the first intervention would be to monitor the vital signs regularly. Decreased levels of consciousness result from blood volume depletion, elevated or decreased glucose level, hypoxia, or electrolyte imbalance. Monitor patient fluid output. Increased output will be the cause of loss of electrolytes. A decreased output will cause a concentration of electrolytes. Monitor the lab results. So the BUN or the creatinine, blood osmolarity, sodium and potassium levels. So elevated BUN and creatinine indicates cellular breakdown from dehydration or a sign of an acute renal failure. So after 24 hours of the nursing intervention, the patient vital signs and electrolyte levels will be at normal range, and the input-output chart will be balanced.
The next diagnosis will be deficient fluid volume related to vomiting and efficiency to tolerate fluids, because the patient was assessed and the patient was vomiting and complained about thirst. So the plan will be to monitor active fluid loss from vomiting and urine and maintain accurate input and output charting. Blood pressure and heart rate will be within normal range, and normal skin turgor will be observed. So the first intervention will be to observe and record input of fluids and output of urine every hour. Because fluid loss via vomiting reduces fluid volume and can result in dehydration. The next intervention will be to monitor vital signs regularly. Hypertension and tachycardia can result from a decrease in circulating blood volume. The increase in heart rate is a compensatory strategy for maintaining cardiac output. If there is an electrolyte imbalance, the pulse is usually weak and erratic. Hypovolemia causes hypertension. The last intervention is to assess skin turgor and oral mucous membranes for signs of dehydration. Skin turgor is reduced when interstitial fluids is lost. The assessment of skin turgor in elderly persons is less precise because the skin loses flexibility over time. As a result, skin turgor measured over the sternum or the forehead is preferable. Along the tongue, there may be many longitudinal fan covering. So the evaluation for this patient will be fluid input and output charting will be balanced. Her blood pressure and heart rates will be within normal range, and normal skin turgor will be observed.
Okay, so this patient is at risk for infection relating to the high glucose level. The goal for the patient is for the patient to remain free of infection throughout hospitalization. So we would do that by monitoring the vital signs and making sure that they do not have an infection, along with teaching them and promoting good hand hygiene. Early detection and treatment of infection can reduce their severity and repercussion. Diabetic patients may be hospitalized with an infection which may have caused the ketoacidosis. They might possibly have a nosocomial infection. Hand cleanliness is the single most effective strategies to prevent illness and transmission of diseases. So we would want the patient to have an understanding of the importance of hand washing and remain free of infection throughout their stay at hospital.
Okay, so because you all chose the Roy adaptations model, it can be seen as an appropriate theory for this patient because the data mentioned each component of the model and This could help with giving a better understanding of the patient and their needs in a way that they would be treated to lengthen their life expectancy and place the patient on a healthier end of the health illness continuum. So good work, students, and enjoy the rest of your day.